Hi and welcome. Today we're going to be talking about the importance of putting your loved one into a good nursing home. Thank you. According to the Center for Elder Abuse, 5 million elders have been abused every year. That is 1 out of 10 patients that are abused in a nursing home setting. So how do you choose the right nursing home for your loved one and lower your chances of this happening? I've worked as a CNA for 6 years now in a nursing home setting. I have heard a lot of stories about nurses and CNAs alike getting in trouble, losing their licenses, and possibly going to jail for elder abuse. Today I will share with you how to possibly put your loved one into the right nursing home. So we will analyze 3 areas. One, the quality of the facility, the second being the quality of the staff, and the third, the quality of the care. So let's begin. With the quality of the facility. When you look into your facility, what do you look for? Personally, I look for if the paint is peeling off the wall. The things that we don't want to see is torn bed linens. The sinks and utilities are working properly. We want to see a well-lit room that doesn't look dirty or dingy and that has very well lit. After all, this is your loved one that we are talking about. You want your loved one to walk into their home and feel welcome and happy. Now that we have talked about the quality of the facility, let's look at the staff. When you walk into a facility, you would love to be greeted with a warm welcome and the staff asking if you needed anything and giving you direction to wherever your loved one is at. Does the staff look happy? Are they interacting with each other well and with the residents? If you're walking into a facility and the staff is angry or in a hurry, or they're treating the residents badly, that is somewhere where you don't want your loved one to be. You don't want to walk into the facility and if the staff's running their head off crazy, that is a likely sign that they might be short-staffed and your loved one might not be getting the care that they need. How are they interacting with difficult residents? If the resident out doesn't want to go to bed and the staff is yelling at the resident or being too stern or firm with the resident, that is something that you don't want to see, because what's going to happen behind closed doors when you go home and shut your eyes? You don't want to worry about that. Next, we're going to talk about the quality of the care that the staff provides when you're not there. You want to make sure the quality of care includes their ADLs, activities of daily living. Their hair is being brushed, their teeth are being brushed as well, and they're getting showers. That they're putting deodorant on, the men are being shaved properly. If this is not happening, they're not doing their job of taking care of your loved one. That is a very important thing to happen. And when you walk into the facility, you also want to make sure that you're not smelling urine or feces. This is a good sign that the residents are not being toileted or their briefs are not being changed as needed. We need, as a CNA, it is very important that they do that. It causes breakdowns and sores on their bottoms. If they are having breakdown and sores, then they are not turning your family member, they're not repositioning, or they are not changing them as needed. Secondly, let's take time to take action towards the residents. Talk to them. See if they like their home. This is where they're going to be living for the majority part of the rest of their lives. We want to make sure that they're happy in their home, and if you're talking to them, also you can notice the smell of their breath. It can give you a sign whether or not somebody's mouth is being taken care of. Lastly, sending your family member to a home is a big decision. When or if you decide to take that decision in the next step in your family member's life, make sure it's somewhere that you would like to be living as well. If you are unsure of anything that is going on in the facility, ask. There is a state survey that is available, ombudsman that can take care of your concerns and do any investigations that needed to be. But take the time to get to know the facility. And lastly, please don't let your loved one be part of the 5 million a year that are being abused in a nursing home setting. That is 1 out of 10. It's a very sad statistic. Be involved. Thank you. Yay!